Okay, we're rolling. So, I'm gonna talk about something very personal to me in this video, and I don't really care who shits on me or calls me something, a term that I find to be very disturbing and disgusting, transphobic. Um, if you don't know my story, I am a 20, almost 21-year-old female who was on testosterone gel for 7 months. I was absorbing it into my bloodstream via what I just said, the gel, and I have permanent effects from this. So I want to talk about androgenic exposure in XX-Chromosome individuals from 20th to 21st century. Okay, this is stuff that's getting talked about, but not very much because they say there's not a lot of studies and research, but really it's just America being America. So this is a advanced retrospection, like written post detransition in circa 2100. Preamble: the primitive epoch of hormonal experimentation. Colleagues, we revisit a period of profound biochemical naivety. The late 20th and early 21st centuries, when exogenous androgens, testosterone, and anabolic androgenic steroids, AAS, were deployed in XX chromosome individuals with crude, often violent, disregard for systemic consequence. Context is critical. This was an era of binary sex dogma, rampant sports, hypercapitalism, and primitive endocrine understanding, preceding the unified soma theory of the 2060s. Historical context, why androgens were administered. I'm just going to be drinking some very hot coffee right now, so if you hear any slurping, very sorry. So these are my reasons why androgens were administered. Athletic enhancement, driven by pre-Great Rationalization sports models where chemical augmentation was both illicit and rampant. XX athletes were often coerced into AAS use by profit-driven systems. Gender affirmation, testosterone quote-unquote therapy for gender transition, though motivated by identity, was conducted with limited longitudinal data and crude dosing regimens. Medical misapplication. I've been a part of this. Sometimes prescribed for fatigue or libido enhancement based on reductive patriarchal symptom models. Phased physiological effects, a retrospective analysis, the cellular and genomic repercussions, the silent cascade. Androgen receptor AR saturation. XX cells with lower baseline AR expression underwent receptor shock, leading to chaotic transcriptional activity. Unlike XY systems, the sudden influx triggered epigenetic scars, methylation, patterns that persisted for decades. This isn't even funny, but I have to laugh to, keep going or else I'll cry. Mitochondrial stress. Skeletal muscle mitochondria, forced into hypertrophic overdrive, exhibited mtDNA depletion and reactive oxygen species ROS storms, accelerating sarcopenia in later life stages. Stem cell niche disruption, ovarian and bone marrow mesenchymal stem cells display lineage confusion, contributing to premature follicular atresia and aberrant hematopoiesis. Wow, I feel like I'm in a fucking House MD episode. Systemic organ impact, reproductive system, ovarian atrophy via hypothalamic pituitary ovarian HPO axis. Suppression was common, but the irreversibility threshold was wildly underestimated. Many suffered premature steroidogenic collapse, leaving them dependent on exogenous hormones by midlife. Cardiovascular system, of course, because men are more known to have heart attacks. The androgen cardio paradox, while XY systems showed some adaptive vascular remodeling, XX systems consistently exhibited accelerated endothelial dysfunction, early onset atherogenesis, and lethal arrhythmogenic right ventricular cardiomyopathy, ARVC. Neuroendocrine rewiring. The brain's intrinsic estrogen-testosterone balance, crucial for XX neuroplasticity and mood regulation, was permanently altered. Outcomes included heightened aggression, roid rage, but also a dysthymic crash post-secession, often misdiagnosed as psychiatric illness. Musculoskeletal system. While muscle hypertrophy occurred, tendon and ligament lag led to catastrophic connective tissue failures. Bone mineral density spiked initially, then plummeted post-secession, causing early androgen-induced osteoporosis. The voice and vocal architecture. As you can hear in my voice in pretty much all of my videos, it's been lowered after 7 months using testosterone. When I was the age of 19 years old, and I'm about to turn 21 February 26th of this year. I am a Pisces with a Taurus rising and a Libra moon, but whatever. Anyways, the voice and vocal architecture, vocal fold androgenization, testosterone-induced vocal fold thickening, and lamina propria stiffening were irreversible. The resulting vocal drop wasn't merely a pitch shift, but a permanent biomechanical restructuring, often accompanied by vocal instability and increased risk of phonotrauma. Metabolic and immunological shifts, insulin resistance, androgens induced severe peripheral insulin insensitivity in XX individuals, a phenomenon less pronounced in XY counterparts. Immunosexual dissonance. Androgens shifted the immune profile from a Th2 dominant XX typical toward a Th1 dominant XY typical response, increasing susceptibility to autoimmune flares in predisposed individuals. Latrogenic harm and societal neglect. Diagnostic shadow, symptoms of harm, fatigue, pain, mood dysregulation were frequently dismissed as psychological or menopausal, delaying care. Lack of exit protocols, secession was managed poorly with little support for androgen withdrawal syndrome, a debilitating condition of hypocortisolism, anhedonia, and metabolic stagnation. Legacy, the path to 22nd century wisdom. These dark experiments yielded our modern principles. The endocrine individuality axiom dosing must be based on AR haplotype mapping and methylation history, not binary sex. The somatic balance doctrine, any intervention must be counterbalanced by supportive epigenomic therapy, for example, AR modulators or mitochondrial stabilizers. The post-binary care model, we now recognize 6 distinct endocrine phenotypical classes, rendering 20th century male-female dosing guidelines archaic and harmful. Conclusion, a cautionary monument. The androgenic misadventures in XX individuals stand as a monument to the sin of physiological reductionism. They fail to see the human body as an integrated sex chromosome influenced but not determined system. Your work today in precision endocrine harmony is built upon these centuries of suffering and confusion. Let us honor their unintended sacrifice with unwavering commitment to somatic unity and biochemical wisdom. Fiend. And ignore this at the bottom because it's actually something else. I was just trying to lore craft it. Yeah, that'll do. Thank you for watching this video. If you've watched this video, I appreciate you.